Hi everyone, my name is Tenille, and today I'll be bringing you a very interesting topic. The topic is nasogastric tube feeding. It can be a sore point at times in the nursing field, but if you know how to do the procedure right, there should be no problem, right? So let's get into it. First, you'll have to get the physician's order. Always get the doctor's order, right? In this, you will validate the amount of feed and the type of feed. You have the renal feeds, you will have the pediatric preparation and high protein preparations, and sometimes it's just for the pure water. So you will have to get the order. After getting the order, you explain the procedure to the patient. Explaining the procedure to the patient, this allows for compliance and that the procedure would be easy. If the patient knows what to expect, then the patient will comply, right? Another thing, you would want to position the patient in a 45 to 90 degree angle. In doing so, this will reduce the risk of the patient aspirating and developing respiratory distress, and even just for comfort, because nobody wants to lie and eat, right? After which, you ensure that you check for the placement of the tube. Checking for placement of a nasogastric tube before feeding begins is one of the very most important thing to do, right? In a Jamaican setting, how we do it, we aspirate on the tube. While aspirating on the tube, we check for the color of the secretion that is being aspirated. If it is coffee ground or even bright red, and you know that you did not give the patient anything red to drink, or green, that would suggest bile. Coffee ground would suggest some form of bleeding. You would have to hold that feed and report to the doctor immediately. If not, and you get back residual feed, show that the patient still has feed in the stomach, it should be less than 100 ml to continue the feed. If it's more than that, you would have to give the patient some time to start the next feed, right? Also, in the United States and other first world countries, they do X-ray of the chest stomach region to ensure that the placement of the tube is there, and also they do the litmus test, which they use the content and check for the pH of the secretion. The pH should be less than 3.5, right guys? Alright, moving on. So after you have checked for placement, you know that it is in the stomach, then we are ready to feed our patient, right? So feeding the patient, you have to ensure that you wash your hands. Gather the supply, the tins, bottles, whatever container that has in the solution or the feed, ensure that the bottles are washed. Okay? So you throw the prescribed amount of feed in a feeding bag. You hang it above the level of the bed so that it can flow with gravity. But before that, you would have to ensure that the tube is flushed with at least 30 cc's of water to ensure the patency of the tube, right? After doing so, you connect the feeding apparatus. Ensure that the feed runs through the entire line of the feeding apparatus before you attach it to the nasogastric tube itself, because you don't want to introduce any form of air in the stomach. Understand? Ensure that you titrate the feed, right? That the patient is not fed too fast, that would result in some form of discomfort or even dumping syndrome. You want to alleviate that. During the feed, you check on the patient momentarily. Ensure that the patient is not developing any form of restlessness, difficulty, anything that can, affect the outcome of the procedure. After that, after feeding the patient, ensure that you flush the apparatus with water again to ensure that the line is clear and the tube is patent. After, ensure that the patient stays at least 45 minutes in the position that they have been placed in. In the elderly and unconscious patient, it is suggested that the patient stays at least an hour or hour and a half in that position, right? Because you would want, this would facilitate for the absorption process to start, reduce the risk of the patient actually aspirating on the feed. After all of that is done, you ensure that you document the procedure, report if there were any abnormalities or difficulties that were said to you by the patient, and just describe the entire procedure in your notes, right? If you follow all those simple steps, then nasogastric tube feeding after a while should be so easy. But ensure that the critical things are done to ensure the safety of the patient, and let's work on the nurse, right? So we have come to the end of this presentation. You can inbox me or subscribe to the channel, right? See you next time. Bye.